and rewire my own brain.
Because she couldn't read clocks, what she did for her first exercise was very simple and elegant.
I took a number of flashcards, I made up a number of times, and I drew the clock faces.
And then she would add a minute hand and a second hand and a hand for the week and the month and the year. And a number of weeks into it, she started to notice some extraordinary changes.
It was incredible. It was like blinders came off. And then what's your next hand? 16. Okay.
Just by these incremental exercises, she was building up new connections in those processing areas so that they could start to function eventually at an average level and then at an above average level.
What I believe this work does through specific cognitive exercises is actually stimulate the function of the underlying brain area to change it, to rewire it, to strengthen it, to improve it, and they can walk out of this program and never have to look back.
I was diagnosed with stage 3 breast cancer 2 days before my 35th birthday. Happy birthday, you have cancer. And I was told that I was going to have to do chemotherapy. I knew about the nausea, the fatigue, things like that, and I certainly got those in spades. But I also found that there's this thing called chemo brain. So chemo brain it's almost like a fog that just sort of descends on you, and it makes it really difficult to kind of process information. I would struggle for word and conversation, so I didn't have that sort of word recall that most people have. It's major memory problems that we take for granted, that we know where we put our keys. I mean, everyone's lost their keys, right? But it's a much more profound thing than that. It's this fog that descends on you, and you can't make out the details.
Well, in any case in which there's diffuse brain injury, as a consequence of something like intensive chemotherapy, basically the brain is operating with increasing noise. Basically, it's struggling to represent information in detail with high accuracy.
Mike Merzenich is the driving force behind scores of innovations of practical applications for brain plasticity. Merzenich's special ability is training people to think and perceive better by working on brain processing areas called brain maps. Our brains represent the external world through these maps, and their borders were believed to be fixed. But Merzenich discovered that these maps can actually grow and strengthen with exercise.
Good morning. Thank you for calling Scientific Learning. How can I help you?
Well, scientific learning focuses on problems in children, and we're basically trying to improve the capacities of children through driving their brain plastically in positive or corrective directions in ways that would improve their academic performance.
One of the systems that he co-developed is called Fast Forward, and it's basically a way of treating auditory learning disabilities disguised as a computer game.
These exercises are game-like. From a kid's perspective, they're fun, but in fact they're intensive, serious exercises, and they're actually optimized to drive the child as far as possible in a corrective or a more normal or more powerful direction as fast as possible.
One of the things that's so powerful about Fast Forward is that before the program, kids with reading difficulties have very unusual scans, very, very different from normal. But as they start to improve on the exercises and as they start to get better at reading, Merzenich was able to show that their brain scans also normalized.
The fish are swimming.
But Merzenich's scientific work is not just for children.
Ready? So this exercise is called Bird Safari.
He has been able to prove that plasticity exists from cradle to grave. And studies show that the elderly can use his brain fitness program to sharpen their memories and function as well as they did when they were from 10 to 25 years younger.
Well, old brains slow down, and old brains, again, represent information with in lower fidelity. You can think of it as a little bit like a radio station that's no longer quite tuned to the station. Older brains forget most of what they hear. Older brains forget most of what they see. A younger brain remembers most of what it hears, remembers most of what it sees. This is machinery that also contributes greatly to controlling how we feel about life, how we operate in life, how closely we can attend to the things and enjoy the things of the world in life. And it's really important that the average older individual keep this machinery in good shape.
Click the matching arrows in order. If you hear, click the up arrow twice.
The Brain Fitness program is this great computer program. It's got several different sort of games that really press you to expand your memory.
What were the first changes you actually noticed?
I noticed my attention span lengthening. That was the first thing that I noticed. But after a couple of weeks and I started seeing changes, then I thought there really is something to this. This is really worth my time. It meant that I was going to be able to function the way I used to. It meant that I wasn't going to be limited by chemo brain.
Well, it was a typical Friday morning. I proceeded to go out to play tennis with a local pro that I've played with for about 25 years. And he says to me, "Mike, your game is not what it usually is." And I said, "My bounce is slightly off," but I continued to play.
Michael Bernstein was an eye surgeon who would work with very small instruments operating inside an eye. And he was a classically trained pianist and a tennis buff who, in the prime of life, at the age of 54, suffered an incapacitating stroke that made it impossible for him to move half of his body.
The left hand, the left arm, and left leg were paralyzed. The speech therapist and the occupational therapist said it would be very slow and not to expect too much.
Michael Bernstein was one of the first people to go to the newly opened Taub Therapy Clinic in Birmingham, Alabama, to try a new treatment called constraint-induced therapy. Dr. Edward Taub developed the therapy for stroke victims. It can even work on people who've been paralyzed for years.
All right, go, Marlene. Go. Really let go of it.
The patient's good arm is constrained in a mitt so it can't be used, forcing their paralyzed arm to try rudimentary tasks.
Keep going.
The axiom in rehabilitation was that there was nothing you could do with these people that would make them improve, that it would enable them to use their affected extremities any better than they could.
Judy had trouble communicating. She had a very serious stroke, October 24th.
One of the techniques that we use is called shaping. It's a kind of training technique in which you get a person to improve their motor response, their motor function, in very small steps.
The essence of the cure is this incremental training. Concentrated practice helps rewire the brain by triggering plastic changes. After there has been massive brain death, new neurons are recruited to take over lost functions.
Pick that up and back up. Yeah.
You don't try and get a person to perform a perfect movement. If they have just a rudimentary ability, you just try to get them to improve just a little bit.
Good. Good. Stretch it out. Stretch, stretch, stretch.
They're children's games to us, but to the patients, they're major life challenges.
Hello, Mr. Taylor. How are you? Quite nice. Very good effort. That's great. Right. Show us what's on your other hand. This one? That's the mitt.
He wears it all day here, and then when he goes home, he wears it for as many of his waking hours as he can.
So that he can't use his good hand.
Right. All right, ready, set, go. Really control it. Really control it.
People who have had stroke or traumatic brain injury frequently don't use the more affected arm, not because they can't use it. They don't use it because they've learned not to try to use it.
Nice. Take it back. Good. 31.74. That's better. That's 7 seconds faster.
What we find after CI therapy is that the healthy part of the brain is recruited to produce movements of the affected arm.
Good.
And that is what we call neuroplasticity.